Welcome, everyone. I'm Mara Yale, and I host and run this educational series with a lot of help from other parents and families. And we're delighted to have this topic today on practical strategies, specifically in the area of executive functioning. I'm going to share some slides to start us off and let the rest of the many registrants arrive. So as I said, we're talking about practical strategies in the context of executive functioning today. This is part of our ongoing educational series on pediatric stroke and brain injury. We understand and know that you, with the lived experience or working with those with the lived experience, know that a stroke or brain injury in childhood or infancy or even in utero has the potential to affect the whole lifespan. And often we start or find a diagnosis in a medical setting, but then we have to live life largely outside of that medical context. And a lot of the series that we offer, the sessions, are about that majority of time that you're spending outside of the medical context. Just as a reminder, the webinar is educational, as are all of our sessions. And so this is important because if you have particular questions for your own family situation, you may get ideas here, but you really need to consult a professional individually. And keep this in mind when you're asking questions. If you can ask as anonymously as possible about situations or challenges without identifying personal information, that's very helpful. Just to celebrate our progress, we've been at this since 2019, starting with in-person sessions and then migrating during the pandemic to virtual sessions. And we like to talk about the growth of our own educational series along its own developmental curve with more and more partners and more topics. So we're always interested in finding new speakers and new topics. And we'd love to hear from you when we send out a survey after today's talk. I just checked, and our top YouTube video has reached 2,000 views. And we're close to 50 sessions delivered. So we're very proud of what we delivered. And if you haven't found us until now, please go look at our past events. There's a wealth of knowledge and information there. We're kind of winding down this academic year of sessions. We take a break in the summer from running sessions. So we have today, and then those who are in or near Boston have the opportunity to come play outside of Spalding right along the Boston waterfront with us. It's our third annual Play to Thrive event, and it's super fun. And then we'll wind down this year with an event May 17th about language development from Alyssa Newport, who's from Georgetown University. I will put the links that I've shared about how to register in the chat, and I know Sarah put also a resource document there. So I'm going to stop share, and I'm going to stop my spotlight as well, and I'm delighted to welcome Sarah Ward, who's our speaker today.
Hi, everybody. Welcome. I am so excited to be here. My name is Sarah Ward. I'm a speech and language pathologist and co-director of Cognitive Connections, which is a private practice where we do all things executive functioning, evaluations and treatment and professional development for educators and professionals. I always love to give a quick shout out to my co-director, Kristen. Kristen and I have been working together for 31 years, and she is the co-author of our 360 Thinking program, which is in almost 1,800 schools worldwide. So you're in really good company today. And just briefly, I want to share a little bit about my background. Whenever you talk about the professional things, oftentimes you can't mention the personal things, but I love to share my personal story, which is that this is my daughter, Michaela, and there's pictures of her little, and she's now an adult. But my daughter she is very ADHD and dyslexic. And when she was little, she was what was called kind of an explosive child, if you're familiar with Ross Green's work. And she would have these huge temper tantrums out of nowhere that were sort of disproportionate to what stimulated them. And it was because she had lagging development of executive function skills. So I was sort of down this path of how am I going to support her? And this is my son, Maddie, and he's also a young adult now. He's 23, but there he is as a little guy. And when Matthew was 1 week old, he and I slipped on stairs and went down the stairs, and he sustained a subdural hematoma. And uh, continued to persist to have some language working memory based challenges as a young student, and I was never really sure how much that was developmental as opposed to that specific event. And for those of you that do or don't know my background, the other part of my story is that this is my husband, and my husband was riding his bicycle. He got hit by an 18-wheel Mack truck, thrown 45 feet, and cracked his skull open, and was in a coma for 8 weeks. And we got out of coma and we got to rehab and we got home, and I was like, wow, okay, here's the situation. I have a daughter who's not developing executive function skills. I have a husband who's lost his executive function skills and had a traumatic, very severe traumatic brain injury. And at the time, I was working at Mass General Hospital on the inpatient and outpatient traumatic brain injury unit. So I already knew a lot about brain injury, but all of a sudden it was my life, and I was the wife of a survivor. And that really took me down the path of, well, then if I know that executive function skills are lost or lagging, what do you really do to improve them? And so today is, from my perspective, going to be all about practical strategies. I am going to switch my view for just one moment, and I would also love to share with you a story and introduce you to Lesley. And Lesley is somebody that I had an opportunity to interview. She has a son who had a stroke in utero. And I would love for you to be able to hear kind of Lesley's story, and then we'll try to address some practical strategies and concerns that Lesley raises as well. So let me switch my screen up. There you go. And we'll take a listen.
Which led you, I'm sure, right, through challenge and passion to do better for your family. However, I don't minimize how challenging
Let me hit play again. There we go.
that can be, right? It's so hard, and often it's our greatest time of growth.
Yep.
I think, as humans. However, not that we would welcome the challenge and the growth in that particular way, but it's often how it's gifted to us, which I like to use that terminology and have that mindset, because obviously having, right, children with challenges or differences, and then a traumatic event within your family, it's really hard to recover, and to right, your central nervous system is affected, and everything is affected. And I wanted to have a child, and I really, right, it is the greatest gift, and I didn't think that it would be so challenging, in the sense of, I thought I would have a baby and come home and I would love and adore this baby, and we would be the best team. I am a single mom by choice, and it is the most amazing gift. And I delivered this amazing little baby that I dreamt of having a boy, and I delivered a boy. And for our connection to come to life. And day one of his life, he ended up in the NICU, and I wasn't aware, understanding, and I was definitely confused. And then when the diagnosis was that he had a stroke, I didn't believe that. And I actually, in my own, I was right, it was a defense mechanism. It was shock. It was just so emotional and so anxiety riddled that I couldn't accept what they were saying. And in my mind, my response was, no, this isn't right. This isn't true. This isn't happening. This is not my child. There wasn't that organic connection with my baby, because I felt like he had hurt me, which of course wasn't the truth. It was a postpartum response. And then, sort of when I processed that, and, was called to action, because that's what I feel like I had to do for my child, I found myself in, clinics, and in swallow clinics, and occupational therapy, and physical therapy, and speech therapy, and, developmental clinic at Mass General, that's following you after having a child in the NICU. And I really, I guess, found my footing, in the sense of became like the ultimate mama bear and advocate.
I
And
love that.
yes, and I'm very type A and very organized. So the flow through to produce for my child was organic because that's really my DNA. So I was able to
Sure.
write this calendar that was full of appointments and working full time. You know, I have a demanding job and a career, which I love. And I didn't really get the support, I will say, which was heartbreaking. My employer didn't support me in the way I felt I should have been supported, but I found my way through that as well. And then, you know, a life of therapy with Roman and challenging him to perform to the best of his ability from a physical perspective. So he has right side weakness,
Okay.
and we were part of the constraint therapy program for years, which was so effective and truly amazing, challenging, heartbreaking tantrums and emotions, but we really together were better. We found our way. We most definitely saw the benefit in the program and the therapy. And you know, he's a thriver at 9 years old, which is amazing. And at this developmental age, he too is dyslexic. He has very intense ADHD. Tics have been part of what we're trying to manage and overcome. And they have, you know, they've presented themselves in a variety of ways. So that's part of
Sure.
the to be part of cognitive behavioral therapy. He too is having more explosive responses to simple requests or, you know, parameters in terms of, you know, what's acceptable and what's not, and you know, scheduling and when TV is appropriate and when it's not. He's definitely had, the last few months has been a much more explosive response to anything that's hard, anything that's sort of not going his way, anything that's not the way that he sees it. And it's definitely been very challenging. I think the last few months have presented in a different way from an academic perspective. Why am I stupid? Everyone's smarter than me. You know, learning is so hard, and learning is emotional and not fun because it's so hard. So how am I able to exercise my patience and to help him with his confidence when we're trying to get through homework that's so challenging? Reading is so challenging, being dyslexic, and
Yeah.
the attention focus is challenging. I found him a tutor. Like I said, we're in cognitive behavioral therapy. He has accommodations at school. But it's really helping him to navigate so that he can continue to grow and develop and feel confident in his skill set and abilities, but also a bit of challenge, I think, in anyone's life with the right support can deliver results. When things are easy, I don't know that it always delivers results in the way that we feel the
I
most
agree.
proud. So I find that, you know, connecting all of this is challenging, and helping Roman understand that this is all for his growth development and for a beautiful and promising future. But these last few months, and particularly this grade level, he's in the 4th grade, has been the most challenging behaviorally, emotionally, and you know, confidence. And you know, how can I do better for him is the way that I am challenging myself.
Yeah. And you, all right.
Which led you, I'm
Oh,
sure.
oops, just one second. Thank you for taking a listen. I'm going to again stop my screen share and go back to here. All right. So, I just really had, I was so honored to be able to interview Lesley and to share and to understand her experience. And we'll hear a little more from Lesley and Roman about some of their challenges. And let's make sure I can give you strategies to support that. But before we kick off, I'm going to ask you all to do me a favor, and I'm going to tell you something to type in the chat box. All right. But you only get to choose one word. Are you all ready? So here it is. I want you to choose only one word. What one word comes to mind when you hear the term executive function? Would you just type that in the chat box for me for a minute? And there's a reason why I'm asking. What one word comes to mind? Great. So I'm seeing planning, I'm seeing busy, organize, organization, lists, sequencing, time management, uh, dexterity, management. Yep, absolutely. Processing, critical thinking. Love it. And this is very typical what I usually get. A lot of people will say, yeah, it's that planning, problem solving, organization, time management skill. And all of that is really true. And those are often the outputs of the executive system. But let me tell you what my hope is. My hope is that by the end of my little presentation here today, that I've completely changed your mind and you have an entirely new word to describe executive functioning. So with no further ado, let me give you our background a little bit of what executive function is and talk about it too from a developmental perspective. And then we'll dive in with lots of practical strategies. So here we have a child who's eating breakfast and mom says, honey, we're out the door at 7:45. Please start getting ready for school. You need to finish your spelling too before we leave. And this is a student who has those executive skills to meet the demands of the situation. And so as she hears that direction, she immediately pulls up into this thought bubble, awareness of time that, yep, it's 7:10. And she pictures, I'm going to play with my dog a little bit. I'm going to wear my yellow team shirt for school spirit day. I think it's in my closet on the bottom shelf. And then I need to go upstairs and I need to brush my hair. I need to wash my face and my hands. I've got to get downstairs by 7:30 to do my spelling so that I have a few minutes of extra time to play with my puppy before we leave the house at 7:45. And with all of that imagery in mind, this student then begins to actually use that talk and say, yeah, it's spirit day. I'm going to wear my yellow shirt. I need to finish brushing my teeth by 7:30 so I can get my spelling done by 7:40. And that way I'll have extra time to play with my puppy. And this is great. And these are not typically the situation that I observe and where families come to me. Oftentimes what I hear more of is the student who's in their bedroom and mom says, honey, please don't eat upstairs. Brush your teeth. Come on, get your backpack. We have to leave in 15 minutes. Hurry. Listen, sweetie, we've got to get a move on. Please stop reading. Go brush your teeth. No, sweetie, 10-minute warning. Come on. We've got to go. We don't have time to worry about your clothes right now. Let's just get your bag packed. Let's get finished getting dressed. Sweetie, we have now 5 minutes. You can dance after school tonight. I can't be late for work. Hurry, get your bag. Did you brush your teeth? Let's go. Oh, and this student isn't engaging in initiating that task. And you can see kind of above me, this student doesn't really have an awareness of time. And these two girls are critical examples of executive function because they're demonstrating the presence or absence of the two key features related to executive functioning. And these are the core foundational skills. And I'm going to put a link to the handout in the chat box again. There it goes. So the first key foundational cognitive skill that you have to have, no surprise to any of you, is working memory. But with respect to executive function always begins with non-verbal working memory. And non-verbal working memory is this mental thought bubble of what something looks like. Think of it as a mental whiteboard. Some students have really big mental whiteboards like this. Some students have kind of average size mental whiteboards, and some students have just really small mental whiteboards. They're not holding on to a lot of visual information. And in fact, some students don't even have a mental whiteboard. They don't create that mental imagery. Now, the reason why you need that is that drives something called conditional reasoning. And conditional reasoning is if then thinking. Well, if I want time to play with the puppy, then I have to be downstairs by 7:40. If it's spirit day, then I want to wear my yellow shirt and it's on the bottom shelf. Notice how that if then thinking drives the second type of working memory, which is verbal working memory. But imperative to see here on this slide is that her verbal working memory is absolutely in the form of self-directed talk. In fact, she's using a very specific type of language called implementation intentions. I am going to, I will, maybe I should do that. If we contrast it with our girl here, no imagery. She wasn't picturing the time. She wasn't picturing what she needed to do. She wasn't picturing what she was going to be looking like to be dressed out the door. And as a result, she does not have if-then thinking. In fact, this is often why students are referred to me for highly impulsive behaviors. They're acting on impulse. But this is actually compelling. This girl does have verbal working memory. Do you remember what she was saying? She can be saying, like, I know, mom. Okay, just a minute. This is cool. And she's dancing around to her Taylor Swift song, but there's no self-directed talk of the actions that she's going to take. So the first core foundational cognitive skill is nonverbal working memory. And a really great way to think about this is it's the earliest aspect of self-regulation. I love this analogy. Think of it as a mental anchor, because think about what an anchor does. An anchor holds you down. So even if I shift my attention, oh, I need to go get my toothbrush, or I need to get my shirt, or my mind is wandering, or I pet the dog, it's okay. Because when I bring my attention back, it allows me to visualize exactly what it is and to see what it is that I need to do. Now, that nonverbal working memory and imagery, it's important to understand from a couple of perspectives. Typically, students that present with brain injury, what happens is this mental anchor, they can create the anchor, but when they shift their attention, whatever is here interferes and this drops out. So that when they bring their attention back, it's like, ooh, what was I doing? And ADHD is actually a little bit different. So that student that has ADHD, in fact, it is not a lack of attention. Children with ADHD, they're paying attention to what's happening right now, that in fact, they're inattentive to what it is that they're visualizing in their mind. So what happens is that thought bubble begins to kind of basically sort of disappear, and therefore they're not attentive to what it is that they need to be doing in that future. Whatever that is not compelling enough to engage their attention in the moment of now. But I want to contrast this even yet again. We also know that students with depression, anxiety, autism spectrum disorder, they're the opposite of ADHD. In fact, they're inattentive to what's happening around them now, and they are attending to this, but it's not to what needs to be done. It's rather to sort of all of those extraneous thoughts, mind wandering, maybe worrying or ruminating. So, the most important thing that I want you to know is first key concept: executive function always begins with nonverbal working memory, which drives this if then thinking, which then drives this self directed talk. Okay, but I said these girls were demonstrating two core foundational skills. The first is this, that role and order of working memory. But the second key thing is that executive function has no correlation to IQ at all. In fact, it's less than 2%. Even for students that present with stroke and injury, there's not a correlate. But there is a one-to-one correlate between executive function and SQ. Now, some people will say, oh, okay, I know EQ is emotional intelligence and SQ is social intelligence, but that's not what the SQ is here. SQ is situational intelligence. And situational intelligence is what we call the stop and read the room skill. And STOP conveniently stands for the features of situational awareness, which are space, time, objects, and people. At any one moment in time, you, me, our students, we are always reading the space in the room. What's going on in this space? We're always aware of the time. What time is it now? What time is the next transition? What pace do I need to keep? We're always aware of objects. What objects do I need? Where are they organized? And this is actually my favorite, this one right here. What's relevant and what's irrelevant? What do you not need? And we definitely have to be aware of people in our environment. We pay attention to what people are doing. But even more importantly, and this is so important, I'm going to highlight it, we pay attention to role. Role is, in this moment in time, what's my job right now? What is it that I need to be doing? So the thing about it is again, at any one moment in time, we are always reading the room. Where am I? What time is it? What objects do I need? And what's my job right now? But the thing is that situational awareness also allows you to stop and know what you need to look like in the next situation. So again, if I have a little guy right here who's hanging out on his computer and he visualizes in this nonverbal working memory, well, I have karate and it's 3 o'clock now, but we leave at 3:20. Look at that situational awareness. Space, I'm downstairs, but I'm going to need to go upstairs and get ready for karate. It's 3 now. We leave at 3:20. I'm in my t-shirt. I'll need my karate gi and belt. My job is to go upstairs and be a karate manager. So the thing is, even though that little guy is downstairs, this situational awareness is what allows him to visualize, oh, okay, well, I'm going to go up to my room, then to the mudroom to grab my karate bag, then to the kitchen, and then back home. And, or back, to the door where we need to leave. All of that is what allows you then to engage in that self-directed talk. Right, it's karate. We leave the house at 3:20. I have to run upstairs, etc. If you're not doing this, then again, you're the kiddo that's on the couch and mom says, come on, we got to go. You have karate. And that kid's just like, yep, I know, and doesn't engage and initiate in that task. So our second key skill here is situational intelligence. However, I'm going to put a plus sign and an equal sign right here. Because even though these are isolated cognitive skills, in other words, I could give you a test and I could measure the volume of your nonverbal working memory. I could evaluate a child's ability to read a room. The fact of the matter is, these two skills actually occur simultaneously. We stop and read a room and we visualize what we're going to look like. The combination of those two skills is actually a processing skill. So here's our girl again, very situationally aware, space, I'm downstairs, but I'm going to be going upstairs. It's 7 now. That's what I need to look like by 7:30. The combination of those two skills is called mimetic ideational information processing. Ha, that's a mouthful. So don't worry about it. But look at the words you recognize. We mime the idea in our head. And this is such an important concept. And when I talk with my adolescents and I say, do you know what a mime is? They all do the same thing. They're like, yep, it's the dude that does this. And they show me the guy that goes like this, or they show me the guy that opens a door. Now, this is very important because this is going to reappear in a moment. I can see some of your cameras and I want you all to help me out for a minute. I want you to imagine that you're going into the bathroom tonight to do your bedtime routine and you're going to brush your teeth. Would you all please mime for me brushing your teeth? Show me. I can see your cameras. You guys can see cameras. Great. Some of you up and down, some of you back and forth. Now, you need to brush your hair. I want you all to mime for me brushing your hair. Ready, go. Great. Okay, perfect. Now, gets really hot in your bathroom tonight and you need to open your window. Please mime for me opening your window. Everybody's changed because it depends upon the window that you're visualizing. Some of you are opening the window, some of you are opening the window, and some of you are opening the window. Cool. So if we define, well, then what does it mean to mime? Mime is simulating an action you are going to do, even though you're not actually in that environment. And every one of you right now is being a mind mime. As you're listening to me, I guarantee you have this movie going through your head that is something like this. Okay, when Sarah stops talking, I need to go into the laundry room. I need to put the wash into the dryer because I'm going to wear those clothes to yoga tonight. I need to take the hamburger out of the freezer and let it defrost so I can make burgers tonight. I'm going to walk the dog, and then I need to respond to emails for work. And everybody, this is the coolest system of all, because you can literally simulate how the future will play out. You can do what we call this mental dress rehearsal. But the best part is you can experience the emotion of the future and do trial and error with no risk of error. If you realize, oh, I need more time to handle those emails, then you can run a plan B. Okay, definitely going to go into the laundry room, handle the laundry, take the hamburger out, but I'm just going to let the dog out. That'll give me more time to respond to the emails, and then I'll walk the dog later. So we are always simulating this plan in our mind. It is a mental simulation. And when we mime that future, we make an image. What will it look like? What will I look like? How am I moving to achieve that goal? And what does that feel like? And if that's what that feels like, then this is what I'm going to do. And again, you're seeing the development of that self-directed talk. So everybody, here's the thing. Being a mind mime then is our next key executive function skill. And so I'm going to put it right here for a reason. And I realize I have a little glitch in my PowerPoint, so I'm going to type it right here. You have to be a mind mime. That's our third key concept. But even though this is absolutely the foundational cognitive executive skill, if you're not miming, you're not able to do executive function. It's only a part A. There's a very critical part B, which is incredibly important with respect to development. So let me show you what this part B is. So here's the thing. If I am 3 years old and I am downstairs and mom says, put on your socks. Okay, I can see my socks right in front of me, my naked toes, and I'm putting my socks on. Well, as kids get older, mom says, honey, you look great. You're dressed. Now go in the bathroom and brush your teeth. And that child is in their bedroom, but they have to visualize themselves going out their door, down the hall, and into the bathroom and brushing their teeth. And as kids get older, you say, honey, please get ready for school. Come down for breakfast. And that child is upstairs, and they have to see themselves going down the hall into the bathroom, brushing teeth and brushing hair, back down the hall into their bedroom, getting dressed, then back out down the hall, downstairs, and eating breakfast. And then your kiddo gets even older, and you go, Mark, 7:15, time for school. And Mark is in the kitchen, maybe hanging out on his computer doing something, and he has to picture himself. Well, if I'm ready for school, I'm dressed and I've got my skateboard and all the things I need for school. And even though he is downstairs, he has to see himself. Well, that means I've got to go into the bathroom and brush my teeth. I've got to go up to my bedroom and get my homework and my backpack and my textbook, down to the living room to get the charger for my laptop, back to the kitchen to get my lunch. And then I need to go to the garage and get my skateboard and meet mom to get out the door. Huh. Okay. One more little thing. Look at this. This is your mantra for the day. I can't even tell you how many kids come to see me and I say, what do you have for homework tonight? And they show me this or they show me this. And they will look at that. And a lot of kids will say to me, not much. It's not a bad night. I'm like, what? You've got 6 questions in science. You have to make flashcards and do 20 problems in math. But I want you to think about this. If all I do is look at my homework and read, I have science, Spanish, math, and a poster. Am I verbalizing my homework, or am I engaging in a mental rehearsal? It's verbal. It's no wonder I don't think I have that much homework. But here's the thing. 90% of the time, task planning happens in a different space from where you execute the plan. That's so important. I have to say it again. 90% of the time, we rehearse and simulate what we're going to do in one space. So as soon as we get to that space, we just carry out that plan. And this girl, if she's got this skill, is at her locker, she doesn't read that she has science. She pulls up that imagery. Well, I'm going to be doing homework at home at 4:30. Science. I know I have to answer questions from the textbook. I better bring my textbook home. I know in Spanish I'm making flashcards. I better bring my Spanish workbook home. You can see she's rehearsing in her mind's eye what this homework looks like. So, why is all of this a part B and why does it matter? Well, the distance between where you are in a moment in time and how far into the future that you can see is called the spatial temporal window or the spatial temporal capacity. It's literally your ability to see in space and time. What do I look like in my room, down the hall, in the kitchen, at school, tomorrow at school? And so mimetic processing literally guides your ability to plan over space and time. But do you want to know what's so scary about it? We have developmental norms for it. Guess how far into the future a 2-year-old can see right now? If you say to a 2-year-old, no, you can't have cookies until after lunch, good luck to you. Because your ability to visualize is not fully secure until 5.5 years of age. So if you say to your 2-year-old, you can have cookies after lunch, that 2-year-old isn't looking and going, oh, I'm at home having cookies. A 2-year-old is like this. This is why 2-year-olds have temper tantrums. They literally cannot delay gratification. 3 to 5-year-olds can see 5 to 20 minutes into the future. That's why you can send your 4-year-old to the kitchen table to do a little color activity, but the most they're going to be there is about 15 minutes. It is not until lower elementary school several hours. So you can give your, first grader come home from school, little snack, little homework, and play date, and that's about it. They can't get the bedtime routine. It is not until upper elementary, lower middle school, you can see 8 to 12 hours. So I can say to that, middle schooler, okay, you have homework tonight. And that student sees themselves doing homework tonight, but they don't see themselves turning it in tomorrow morning. It's like, I don't see it. And they leave it on the kitchen table. Those of you that are parents of high schoolers, brace yourselves. It is not until you are in high school that you can only see 2 to 3 days into the future. That's it. So when the teacher says, you have an essay due 3 weeks from now, you know what your high schooler does? Sweet, I have an essay due 3 weeks from now. Whatever. I don't initiate. 2 weeks in, I got an essay due. 1 week, I'm starting to see it. And then 2 days before it's due, I go, oh my gosh, I have an essay due. And I start to panic. Totally normal, healthy procrastination. Because now that I can see it, I feel the urgency of it and I'm prepared to sort of like do something. It is not until young adulthood you can see 2 to 3 weeks. And it is not fully into adulthood that you can see 3 to 5 weeks into the future. And two very important points here. First of all, your frontal lobe, which generally houses these executive skills, is the very last part of the brain to developmentally mature. In fact, it's not fully mature until 23 to 26 years of age, which is probably why you've all met a young adult who took a while to kind of come into themselves. And the other thing is, you might be saying to me, well, I don't get it. I'm an adult and I can see well past 5 weeks into the future. So what do you mean? Well, let me give you a good example. Let's imagine that a student has a history test, okay? If that test is 2 hours from now, I'm like, I have a test. I am going to study. If that test is tomorrow, yeah, I got a test tomorrow. I got to study. Now, if you tell me that test is next Monday, I'm like, I have a test next Monday. And if you tell me that'll be on the test sometime next week, I'm like, whatever. And if you tell me it'll be on the unit assessment, and if that's the midterm, sure, whatever. I don't care. It's not, the time horizon is not an absence of imagery. It's that it's like it's so far out there, it doesn't bring me to action. I can't see what action it is that I'm going to take. Now, here's the thing, and this is kind of a joke, but not really. By show of hands or yes in the chat box, or you can raise your hand, how many of you have ever heard of a diagnosis called ADHD? Yes, it's a joke. Okay. Well, believe it or not, there's actually a bit of a push to change the diagnosis of ADHD to EFDD, executive function deficit disorder. We absolutely know that students with ADHD present with a 30 to 35% developmental delay in this specific skill. So let's imagine that maybe you're here today for a student who is in the first grade and they're 6 years old, and you expect that student to hang in there several hours. Little homework, little spelling, little snack, little homework, play date. If your child has ADHD, then their adjusted executive function age is 2.5, which means they're focusing at best now to 5 minutes. And that's why it's like, nope, nope, it's snack. Nope, let's get your homework out. Nope, let's do all these things. Lots of queuing. Maybe you're attending today and you have a student in the 7th grade who's 12 years old. We expect that kid to hang in there several days. So they go to school on Friday and the teacher says, yep, that math assignment is due on Monday. We expect that student to be able to picture, I'm turning that in on Monday. But if that child has ADHD, their adjusted executive function age is 8.5, which means until there's several hours before that assignment is due, it's like, oh, that assignment is due. And they're texting or calling you, Mom, bring me my assignment. And to put this into, like, again, a visual for you, if your little one has that brain injury where, there's this gap in that spatial temporal window, and the assignment, and they need to be able to work for 10 minutes. That means, right now they can see themselves, but 2 minutes from now, it's looking like that. And 4 minutes from now, that literally, if you're asking them to work for 10 minutes, it's too far out there. Whatever, I can't engage it. And that's why those kids have such a hard time engaging. And it's why we often need to sort of sit with that student in the moment of now to keep them moving through that task. And so our next key concept then here is how far into the future that you can see the spatial temporal window. And it's sort of funny because of all of my slides, this is my favorite slide. It's not the most whizzy, but it just makes so much sense to me. This is the core of executive functioning. We stop and read a room. We visualize what it's going to look like, rehearse what we need to do over time. You're all doing it. What am I going to look like after Sarah's presentation? What's coming up tonight? What's going on this weekend? What's next week? And then what? We're always moving towards that next major thing. Now, I'm going to just quickly give you a summary slide so that I can get to as many practical strategies as possible. But while there are many models of executive function, I'm going to share with you the model my co-director, Kristen, and I developed. Executive function always begins with that ability to stop and read the room. Then in our mind, we rehearse, simulate, and prioritize and organize what we need to do so that as soon as we get to where we're going, we initiate a task while inhibiting distractions and pace ourselves towards completion. And that's what allows us to compare planned versus actual. Well, this is what I wanted it to look like. Uh-oh, this is what it does look like. And if they don't match, then I need to kind of control my emotions and shift. And in fact, that's my favorite phrase. I even made my mug off of it, that shift happens all the time. We have to shift. We constantly have to be flexible. And some of our kiddos really struggle to be flexible. But everybody, this entire thing all occurs on a timeline. What time is it now? By what time do I need it to look like that? And then what? So we always have to be addressing time. And this is why we call our program the 360 Thinking Program, because it's constantly going around and around. And I work with so many families and clinicians and schools, and I say, are you working on executive function? And they say, yep. And I say, great, tell me what you're doing. And unfortunately, lots of parents, lots of teachers, professionals are teaching executive functioning. And you might say, okay, well, wait a minute. Isn't that the point? But here's what I mean. What they're doing is they're starting right here. You see me highlight that. They're starting with teaching task execution. Get ready for school, get ready for bed, get ready to do your homework. Let's get ready for soccer practice. Let's get ready to get out the door. Everybody, you cannot start executive function interventions with get ready. If you start with get ready, you will have given a goal, but you will have bypassed every single underpinning of executive function, which is situational awareness and that mental simulation. And, you know, I'm going to just give you this because it's a little bit like what we described for adults. It's what we call the liquid plumber problem. And the liquid plumber problem is, have any of you ever done this? You look at your sink and you go, oh, I have got to get liquid plumber. And you go about your day and you go to the grocery store and you come home and the next night you're like, I can't believe I forgot the freaking liquid plumber. And the next day you're like, I have got to get liquid plumber. And you even go about your day and you swung by Home Depot and you came home and you're like, I still didn't get the liquid plumber. And you might have even put a note on your phone and you still didn't do it. And so many clients with brain injury will say, I don't remember to remember to remember. And the thing is, prospective memory, this ability to remember in the future, has to have a cue and a task. The cue is where and when am I going to do that? That situational awareness, space and time. And then it's when I'm in the grocery store at Target. And then you have to have the task. What do I see myself doing in Target? By the way, this was a very seminal article that was published on traumatic brain injury. I really encourage you to check it out. It's excellent. So we have to teach that future simulation skill. Okay. So when we talk about intervention and all practical strategies, and again, I'll put a link to my, maybe I didn't get it to anyone. There's a link to the handout. Let me introduce you to our 360 thinking methodology. Our interventions are based upon this idea that we know the only way we're going to make these skills independent is if we teach students to stop and read the room, see the future, say the future, feel the future, play with the future, and go towards the future. That's the skill that we have to teach. And that's what I'm going to show you today. In other words, we got to get our kids to be mind mimes and mime it and do that mental dress rehearsal. That's the skill we're teaching. Okay, so in my little first part of practical strategies here, I'm going to show you how do we get kids to stop, see, and feel the future. And we want to talk a lot about routines. So let's listen for a minute. Let me stop let me share my screen and let's take a listen to Lesley share her experience for a minute about routines.
Routines are challenging. Routines are not met with excitement. They're often met with challenge and upset and emotions and dysregulation. So I have tried to include visual supports, a time clock, a lot of tools that have been recommended to my family from a variety of professionals. Things tend to be so short-lived with Roman, where I find the greatest challenge. What can I put into practice that has staying power? That's where I'm the most challenged. So I've had the visual supports. You know, they've been out and I've walked him through it and he was very excited and energized. That's often his response to things that are new. He can be excited about them, but it's for a very short moment. And then he's very stressed by them. And then then there's a negative emotional response to that. And I don't know how to course correct that. I don't know what to do to accept that this is a helpful tool and not a stressful tool. And sometimes he likes it, and other times, most times he doesn't. And there's an emotional crash, which makes it so challenging. So morning routines, Roman is, to say he's obsessed with the TV is an understatement, which I know is a very classic ADHD request and behavior, is focusing on the TV. I've tried to set guidelines around the TV, how long, when we turn it off, if we're dressed, if our breakfast has been eaten. But it's very challenging. He's not able to follow a morning routine independently.
Okay.
So, and especially, right, morning routines often have more than one step. And he cannot connect what comes next, what should I be doing, is what has been asked of me done prior to doing what I really want to do. So that there's so much confusion around that, which often leads to a tantrum of sorts, or an explosive response that typically, right, I guess you may not experience. And it's just been, I've been at a loss myself as a parent to figure out what's the most musical way that I can present this to my child that gets him to grow and develop independently and sets our morning up for a more pleasant beginning to our day. There's
Yeah, it
often
gets really stressful to have a tough
so
morning. Yeah.
stressful. And there are more than frequent reminders. And he's just not able to, like I said, to connect the tasks that need to be completed so that we can go to school. So getting dressed, breakfast, brushing our teeth, putting our lunch in our bag, our water bottle, it's just so hard. And I often need to chaperone.
Yeah. So you have to be there. So if I were a fly on the wall and it's fine, you help him get dressed and you say, okay, now you need to go into the bathroom and brush your teeth. Does he get distracted along the way, or does he get into the bathroom and then he's just not brushing his teeth? You know, is he kind of playing with other things, or is he just resisting going into the bathroom? Like, what would be the observation?
Very distracted along the way. And he might go into the bathroom and then decide, oh, but I'm doing my hair. So now we're doing our hair, although hair typically isn't part of the morning routine, but then sometimes it will be per his request, which is fine. But then and then we are not brushing our teeth, and we've lost sight of brushing our teeth. So now we're focused.
And if you say to him, okay, so I'm going to pause my screen share there for a minute, come back, because I want to give you as many practical strategies. I'm sure a lot of you can relate to that. And let's talk about, what do we do differently for routines? So with all of that in mind, you should be seeing my screen again. Let's talk about routines, because routines do require this forethought and this transition through space and time. But remember, I said we definitely don't want to start with get ready. Mara, could I ask you a favor? Would you mind unmuting and helping me for a moment?
Sure.
I'm going to be this little girl, and notice my hair is not brushed. I'm still in my pajamas. I'm eating breakfast, and let's say the bus is going to be here in 10 minutes. I would just like you to be a classic parent and help me get ready for school, because again, the bus is going to be here in 10 minutes. So go ahead and you can read that prompt if you would like.
Honey, we need to leave for school at 7:30. It's time to
I know,
get ready.
mommy, one more bite.
Time to get ready.
Mommy. Look at this.
It's time to leave the cereal now.
Mommy, it makes a whirlpool in the Cheerios.
Oh, I love that, but let's look at that later. It's time to get ready.
1 sec.
Okay, now we have 3 minutes.
Yeah, no, I love this one. Okay, you ready? Here's the thing. This is so important. Did you all hear what my mom was just saying? First of all, at this point where mom is saying, okay, that's great, but now we only have 3 minutes. You need to go upstairs. You need to brush your hair. Who's the one that's mind miming? Who's the one that's situationally aware?
Mom.
Mom is. You're the one that's picturing me putting the bowl in the sink. You're the one that's picturing now we only have 3 minutes of time. I'm just sitting here going, I know. Thank you, Mara. Now, here's the thing. Almost every parent and every provider said, I read a blog about executive function, and they said, go ahead and put a checklist right there on the kitchen counter for the child. Now, based upon everything I've told you, our checklist thumbs up or thumbs down? Actually, they're thumbs down. And it's not where we start the intervention, because the problem is a checklist only triggers verbal working memory and not self-directed talk. I read it. I need a headband, a sweatshirt, a snack, and a bag. But the reality is, Mom, when you just said to me, we're out the door, that's not what you wanted me to picture. What you wanted me to picture was, oh, okay, that's what I look like by 7:30. Hair is brushed, I'm dressed, I've got my bag. And if that's what I look like, then this is what I need to do. I need to go upstairs and get dressed. I need to go into my bedroom or my bathroom and brush my teeth. I need to come down to the kitchen and get my bag. That's what you wanted me to do. Well, there's another point here about why checklists don't work. Do you remember just a little bit ago, I asked you all to mime for me brushing your teeth, and you all went like this. I said, mime for me brushing your hair, and you all went like this. Well, it's fascinating. When you say to someone, where are you going right now? Or what are you doing tonight? This is what they do. Watch me for a minute. They're like, oh, well, as soon as this is over, I need to pick up my son at school and bring him home. And I have to go get the other one at hockey. And they reach all the way out hockey, get him home. I'm going to put dinner on the table, and then I need to do the laundry. Or they're like, oh, I got to do the laundry. And you can tell I'm visualizing. I have a little laundry. I have a lot of laundry, that my son is all the way across town. That hand motion, oh, I need to run upstairs and then I need to go into my bedroom and I need to come back downstairs, has a very specific name. It is called representational co-thought gesture. And co-thought gesture is not co-speech gesture. It has no communicative intent. It's an outgrowth of how we are simulating the future. In fact, it's a embodied rehearsal of what it is that we are going to do. It basically externalizes our thinking, and it even gives an emotional charge to our plans. I have to do laundry, or oh, I got to do the laundry, or I got to go all the way across town. And everybody, do you want to know what's so fascinating about this? Co-thought gesture emerges before the 25-word milestone. So this is a skill that is developmental to executive function. And when we say you want to improve executive function skills, you have to teach a student to stop, see, say, and feel the future. We literally mean feel the future. Reach out, touch it, and hold it, and say, I need to go upstairs. I need to go to my bedroom. Gesture fits into this role of working memory. It's part of the mime. It's literally miming. I need to brush my teeth. I need to brush my hair. Gesture is crucial to the development of executive function. So let me put a little summary point on this, and here's my strategy. When your child or student has done what you want them to do, they're dressed and ready to go to school, they've got, they're set for soccer, whatever it is, grab your phone and take a picture and say, bye, have a lovely day. The next morning, when that child is eating breakfast or it's time for soccer, pull up the picture and say, honey, remember when you were ready for school yesterday? This is what you looked like. But that is not the magic phrase. The magic phrase is show and tell me your plan to match the picture. And always start your direction with the word show me. Because the minute I say, show me your plan, I evoke that motor neuron planning pathway for executing the task. I need to go up to my bathroom and brush my teeth. I need to go into my bedroom and get dressed. I need to come downstairs. And the thing is, it doesn't matter what age your child is. I mean, I do this with high school and adults. I just teach them this is where executive functioning starts. Now, a lot of people will say to me, well, gosh, you know what? I have a couple concerns. First of all, I have a child who's a little rigid. They would say, I don't want to wear that shirt today. Or a lot of parents, and actually pictures teach cognitive flexibility. I'll show you how. Or I have a lot of parents who will say, we already tried visuals, right? We already did that. Even Lesley said, we tried visuals. Is this an executive function visual? It's not. It's a verbal checklist with pictures, and it will not generalize and it will not work. Because the problem is, I've taught you executive function is an episodic miming rehearsal skill. The one on the left simply is rote reading, and it overloads the working memory system. Whereas the single image is what allows me to visualize what it is that it's going to look like. And I'm really miming. When I say, oh, it's time for soccer, show me your plan. Look at the problem solving I have to do. Oh, I need to go down to the den and get my, yoga mat. I have to go out to the garage and get my soccer ball. My bag is in the mudroom. When you ask that student to gesture is like a mental highlighter. It allows that student to rehearse and highlight in their mind what it is that they are going to do. And by the way, here's another key point of why we don't like these, all right? I can give you a test and I can measure the volume of your working memory. Do you have this much working memory? Or does your child have this much working memory? But what we often don't talk about is how much time do you have as a parent to access working memory? And we know the answer to it. You have 3 seconds. You have 3 seconds to access working memory. So if you guys have been zoning out, watch my my slideshow. Are you ready? Time for, time to go home, right? Time to get ready to go home at the end of the day. Here we go. You guys good? It's way too overwhelming, as opposed to, here we go, time to go home. That's the difference. It's that it allows me to capture an image and rehearse and to pull it. So we really don't recommend these, again, for a reason. And I really want you to see this image because I thought this was just fabulous. And I'm going to zoom in on this just a little bit so that you guys can really see it. This was a classroom that I recently worked in. And if you look right here, the teacher has a photograph of exactly what prepared to be a student in class looks like. And it's an image of her, but she has what's called ready hands, and she has her cards laid out in front of her, and the folder is on the blue square on the table. And she did not use one piece of language other than to say to the students, show me your plan to match the picture. And the kids would look at the picture and they got up and they got their folder and they came back and they would look at the picture and they would take out their pictures. She would tap the photo to show that the folder needed to go in the center and they would put it in. And if they didn't have ready hands, she just pointed to the picture. And the kids did all of the problem solving. We don't want to just verbalize direction, 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 and have the kids just basically kind of blindly follow those directions. We want them to be problem solving and simulating. So please, please do me a favor, write in the chat box, show and tell me your plan, because that is a core strategy, but that's only a part 1. I have to give you a really big part 2. Even if you say to a teenager, show me your plan to get ready for soccer, and the teenager rolls their eyes, I'm actually okay with that. Because when we say that word show, it gets the brain to envision how it's moving through space and time. Yes, thank you for typing that in there. I want you guys to get this. Somebody asked about backward chaining. I will talk about that hopefully in a moment. So our next key concept here is that we want our students to start with the done and show and tell me their plan. Now, here's the thing. I love this next question that came into the chat box. The next question says, Lauren says, uh, how do I get them to eventually do the planning all by themselves? Okay, great question. Let me show you how we do that. Because the next strategy here is we want to develop organization and independent problem solving and planning. So when you have a photograph, what I want you to not do is not just print out a bunch of photographs, because if you print out a bunch of photographs and put them all over your house, just like Lesley described, they're very quickly going to become attuned and ignored. So when you have a photograph, we use a technique called feature blocking. You want to take that photograph and ask the student, have a session where you're hanging out with your child and say, when you were ready for school, this is what you looked like. What's one thing that tells you you're ready for school? And the child says, my hair is brushed. So what I would do is I would draw a box around that. Now, hair is a detail. So I'm going to put a box and generalize it to the feature or the organizational category of being ready. That means my body is ready. The child says, I have my backpack, and draw a box around it, backpack. I have my lunch bag. Lunch bag is a detail. So I'm going to call it the feature of lunch, because one day I might bring a lunch bag. Another day I might bring a lunch box. I'm wearing sneakers. Sneakers is a detail. So I'm going to call it shoes, because one day I might wear flip-flops and another day I wear boots. I'm wearing a t-shirt. T-shirt is a detail. So I'm going to call it clothes. Then what we recommend is you put this inside a plastic sleeve protector. All right. When you put it in a plastic sleeve protector, it becomes a write-on wipe-off surface that you can use a dry erase marker with. And the goal here, remember, is we want students to visualize what that future is going to look like and to be able to do some of this independent planning. So here's an interesting story. I want to show you this image of a girl that I worked with. You can see we did the feature blocking. We put this inside a plastic sleeve protector, although it was this kind of a plastic sleeve protector. And this family was in serious distress when they came to see me, because this girl had such challenges with time management that she was often late, and her dad had to drive her to school. And then he was late for work, and he had lost 2 jobs at the point where they came to see me. And so they were really stressed. So I feature blocked with this girl what dressed and ready to be out the door would look like. And then what I love to do is I will show a photograph of the future space and context of where you are going to go. Well, you're going to go to the indoor trampoline park for your exercise class. If you are there, I want you to show me, how would you look the same but different? And same but different is the key skill and phrase that we use to develop cognitive flexibility. Well, same, my hair really needs to be in a ponytail because my face gets hot and sweaty and I don't like my hair to stick to my face. And you can see she just drew a ponytail. If I were jumping, I would need a t-shirt, and she drew a t-shirt and shorts. If I'm jumping, I need long socks. Then I might say to her, okay, we're going to be going to the beach. I want you to show me what you would need to do to go to the beach. Well, I like my hair down so it doesn't stick in the scrunchie. I want to wear my blue suit, and she's shading on it. I want to wear my cover-up skirt. I'm wearing flip-flops. And all she's doing is drawing right on top of that picture. By simulating what that future experience is going to look like, all of a sudden, she was able to engage what it was that she needed to do and quickly run upstairs, get that gestalt whole picture of, yep, I have my swimsuit, I have my things. But watch this, everybody. Are you ready? This is why I'm being very emphatic about this. If I say to a student, okay, we're out the door, you're going to the beach, it's not the same. I can't simulate it. You've got to really get that simulation. You have lacrosse. How are you going to look when you go out the door? You want that student to use that future experience. Even if you're working with a young adult, you're going to an interview. All right. And again, I put it inside a plastic sleeve protector. What does your body look like? I have to be shaved and my hair is brushed. My shirt needs to be tucked in. My pants need to be brown. I need my brown-toed shoes. Okay, great. You're going to, the town pool to exercise. Well, I need my pool shirt. I need my swim trunks. I need my pool bag. I need my pool shoes. In my pool bag, I need my goggles. Now, as a student gets better with this, the next thing I do is I actually slide the picture away and I leave the student with what's called cognitive mapping. Now, with that cognitive mapping, it's not a list. They're beginning to rehearse what it is that they need to look like. And I have to emphasize here that executive function is not a planning and organization skill. It's not. That's the product. All right. And you might say to me, well, what's the difference? That's a plan. Okay. Take a homework, take a bath, all the things. Executive function isn't the ability to sequence the steps. It's the ability to simulate and run the movie through your mind. Well, that means I have to finish my homework by 10 after. It means I need to brush my hair and wash my face and use the bathroom so that I'm in bed by 7:30 so that I have time to read with dad. Planning is the sequencing and the identification of the steps. Simulation is miming. It's doing this executive function skill. And even when we talk about time management, and I'll still get you some practical strategies, if you have a calendar on your phone and you say, I have class at 8 o'clock this morning, that's a plan. That is not a simulation. All of these tools, clocks and timers and calendars are simply prompts for mind miming. If I look at that, I can't just read I have class. I have to simulate the plan in my mind. Well, what does that actually mean? That means I've got to walk to class. And as soon as I get to class, I don't actually want to be late because then you have to sit in the front row. And I can't stand sitting in the front row of class because then you're way too close to the professor. And actually today, I know I'm doing a presentation with Alexa, which means I need to meet with Alexa before class even starts, which means I actually have to, let's see, if I'm going to meet with her before, get her the PowerPoint, which means I need to send her the PowerPoint from my dorm. If I'm going to send her the PowerPoint from my dorm, then I might not have time to actually walk to class. I might need to skateboard instead. That would get me there sooner, and I could get a cup of coffee. Yeah, that's what really good executive function is. It's what allows you to simulate that plan. And so it's so important. I'm going to, again, go back to the example of where Lesley was saying, TV is really important to this kid. He's got to watch TV. Okay. I would take my photograph and I would add a thought bubble and put the television in that thought bubble so that the student is constantly holding on to what that future skill is. And then they're matching that image of, yep, that means I need to go upstairs and get dressed. It means I need my coat. It means I need my boots. And then I get TV. You're always holding on to that plan in mind. Please do me a favor so that I know you're actively learning with me. Let's do a fill in the blank. Executive function is not a planning skill. It is a what skill. Let's put it in the chat box. So I know you're holding it on to memory and you're learning. Yay. Yes. Simulation. I am woefully, Mara. I know I'm going to take questions in a hot second. I worked in a school where they had a checklist in the shower of all the steps of what a student needed to do. And it was a wet erase marker. They could mark it off. But this student was having so many problems moving through this routine in a timely way, even though they had like this pictorial checklist here. So instead, we photographed this student and we basically kind of what I would call feature blocked this routine. You're getting the shower ready, then you're doing hair, then you're doing face, then you're doing arms and body. And that really helped that student. Now, I've given you quite a few other examples in your electronic handout. But, again, if you're going to say to your child, please do the chore of the recycling today, make sure you take the cans to the end of the driveway and they need to be 4 feet apart and 4 feet from the mailbox. I guarantee your child heard want, 4 feet, want, mailman. Instead, simulate and do the task with your child. Literally with them, photograph what that's going to look like. And then say, honey, it's your time to do the recycling. Show me your plan so that I'm seeing that image. And again, if I wanted a child to clean a bedroom, I wouldn't do this. I wouldn't take the messy bedroom and give a checklist. With the student, I would get the bedroom cleaned up. I would feature block that bedroom, and I would add a future thought bubble. And I would say to that student, what is it that we're looking forward to doing this afternoon? And that child says, I want to go downstairs and make cupcakes. Okay, cool. There's your cupcake. Draw a cupcake. Get that child excited to see, yeah, I'm thinking about making cupcakes. And then what happens is you can send them to, now, again, the room might be messy, but as that child's holding it, they look at it and they say, oh, okay, the animals need to go in the bin. You know, I'm looking at this picture. I can look here and go, there's an animal, there's an animal, there's an animal, put it in the bin. So I think that makes a lot of difference. And again, I would just sort of add here, feature block to develop cognitive flexibility. How will it look the same but different? There was a question about gesture. Gesture emerges before the 25-word milestone. It emerges actually even in infancy and in kids are very, very young. Mara, I have a thought on something. I'm sure there are questions. I really wanted to have a chance to chat about 2 time management strategies. Would it be okay if I did a quick time management strategy? You tell me what would be most helpful.
Yeah, I feel like you're responding to some of the questions in the chat, and there's a lot of thirst for your knowledge. So feel free to share the time management strategies, and if there is time, we'll take some questions live. If not, you've shared the handout, and people do want to know how to find you, so we'll definitely put that in
You
the
bet.
chat as well.
You bet. So I'm going to watch my time and teach 2 time management strategies. I am going to, this is, I think, a little quick, but I do want you all to take just a minute to hear Lesley's experience, because I think too, it is very important. And it's not very long. I want you to hear as a foundation for some of my strategies for time management. There it goes.
I mean, he's definitely more motivated, but oftentimes, interesting you ask. So when he's excited about a destination, an event, maybe hanging out with his friends, he's very focused on only that, and then very aware that there won't be enough time with this friend or at this event or at this place. I don't want to do anything else, because in his mind, it's taking time away from where he really wants to be. So it's often met with, but now I'm not going to have time. And now there's no time. And now he feels that it's all a takeaway. And then he becomes upset. But I think it's just, I don't know if it's a form of anxiety that also is coming into play, but that's
okay. So I will pause there for a moment and let me come back and remind you that time underlies every single aspect of this simulation skill. So we really have to be able to make time visible. And if I say it's 1:10, we're going to leave it a quarter after to go to your friend's house. Do you know how many problems there are with that? There's so many problems. Even if I tell the child in the kitchen, okay, it's 1:10 and we're going to leave it a quarter after. The fact that that says 1:08 doesn't match the language of time, 1:10, but the other thing is digital time is the equivalent of verbalization and not mental rehearsal. I'm reading it. It's 1:08. Because when you said it's 1:10 and we're going to leave it a quarter after, you meant it's 1:10 and we're going to leave it a quarter after. That's what you wanted them to see. So our recommendation with hourly time is that your home setting has two different clocks. The first clock is you've got to get an analog clock on the wall, but I want you to call it the wall clock. And there's a reason why. You want to say the wall clock says it's 1:15, the wall clock says it's 2:45, whatever it is. The only purpose of a wall clock is to tell you the hour of the day. We then recommend that you have a second clock. It does not hang on the wall, and we call this one the working clock. Now, we call it the working clock, not because it has a battery and it's working, but it goes wherever the student needs to do work, at their bedroom desk, in the bathroom, in the living room, in the kitchen, wherever that student needs to do something or work during that time. Because if I go back to my example with Mara, this being my mom, you know, Mara, you said to me, okay, now you only have 2 minutes, honey, and you need to start getting dressed. The problem is, Mara, you're the one that's seeing 2 minutes. I'm not. So with the working clock, the coolest thing is you can take your analog clock and you can take a dry erase marker and you can draw right on top of the clock what the available time is. We have 5, 10, 15 minutes before we're out the door. And I can shade on the clock to show the volume of time. But not only can I get that student to see the time, I can also plan the time. And if I'm planning that time, just grab my other marker. I can even really identify, oh, of course, this marker's going to die. Isn't that always my bad luck? Let's try this one. Hold on. Here's where I can show that student that this is where we have time for teeth. And then maybe here is where we're going to get dressed. And I can literally write on the clock. Now, the value of this is it's not a timer. And I have a lot of kids, you show them a timer and they get so anxious. They just don't know what that is. So the value of this is that as time is passing, I can literally see where I am in the passage of time. But even more importantly, it develops metacognition for time, because I can now look back and say, well, what was I doing during that time? So if you want to support your student with homework, you can put that plan on there. And the other thing about this is if your student is doing more like homework, we love to actually create the time plan with Post-it notes on the clock, and we call those time markers. So if your student's going to be working for a half hour, you can identify the goal. Okay, well, at the end of this half hour, I've answered 10 or 11 questions. Always create a midpoint check-in. The midpoint, I want to be around problem 4 and have the student mark their work. This is where I want to be at the midpoint. The reason we create that midpoint is that we want students to have the chance to check in and not suddenly lose a half hour of time. It gives them an opportunity to get back on track. Because if I'm a student and my visualization was, yep, at the midpoint, I have 4 problems done. But if at the midpoint check-in, I only have 1 problem, my actual doesn't match my plan, which means I can self-monitor and figure out, well, why? You know, like what's going on? What's the problem? If you're going to set a timer, in this example, never set a timer for a half hour. Always set the timer to the midpoint volume of time. In this example, 15 minutes. When you set it to the midpoint, you're teaching self-monitoring. You're giving that child the opportunity to check in and say, okay, you know, what was it that I was doing and what do I need to do? And it's unbelievable. It allows that student to check in. If you have a youngster who is struggling with, reading and verbalization, I love to actually put Velcro on a clock, and then I can just attach images to my clock of what I need to look like at a certain point in time. And definitely check your handout for a lot of other examples of clocks and things like that. But I really, really have to give you one last time management strategy. little summary point, we definitely use our working clock. Sorry about that. I'm covering up my own slide. We use working clock to shade the time, to help students self-monitor and be metacognitive about how time is spent. And that gets our concept in there of making time visible. We really have to do that. But I want to give you, that is great for hourly time. I want to end on a practical strategy of daily time that I think is so critical. And I want you to hear again a little bit of Lesley's experience. This is just a quick clip. It's about 1 minute, but I think it's so valuable. I want you all to hear this. It's just so important.
Yes, frustration, yes. And even lately, what he's been saying to me. So I prefer a specific coffee, and it's just, a 5-minute walk, not even. And I'll say, I want to go get my coffee and then we can go to the park. He will say to me, no distractions. You can't talk to anybody along the way.
Oh,
Because we live in a community where we know everybody knows us, especially my kids. They love to see them. Look how big they are. I mean, we live in a family neighborhood, and this is why I love living here. People really look out for us.
yeah,
They
it's
also
so
want to
nice.
engage. It's wonderful. It's so nice. They want to engage and say hello and, wow, you guys are getting big. Like, what are you up to today? Or whatever it is. He has just started in the last 2 weeks. You can get your coffee, no distractions.
Okay. How do we handle a situation like that? What do we do? All right. So here's the thing. When we start to talk about daily time and getting kids to understand, all right, when am I going to do my work? Or what does that schedule look like? Lots of times we tend to tell kids that verbally. You have a tutor today, or you have your therapist today. And if kids just hear it, they can't visualize it. And you might say, well, I put it on a calendar. Well, a monthly calendar is way too macro. It extends that spatial temporal window. And if your child is using a planner, an academic planner is a to-do list. It's not a schedule. And even if your student has a planner that looks like this, Monday, Tuesday, Wednesday, Thursday, tutor at 2 p.m., that's still a problem. Because even though the tutor is 2 p.m., what it really looks like is this. You have to get ready to go to the tutor. We drive to the tutor. The tutor is an hour. Then maybe mom meets with your tutor, and then you drive home. That's what it's actually looks like. So even when we look at middle school schedules, this is not, that's a schedule, but it's not teaching time management, because if you look over on the left, that's 40 minutes, that's 80 minutes, that's 15, and that's 75, but it all looks the same. And if this is what you typically do for your child, you write 8 to 8:20, 8:20 to 8:30 break, 8:30 to 9 is a reading lesson. Don't get mad at me. It's a no. Because 8 to 8:20 is 20 minutes, 8:20 to 8:30 is 10 minutes, 8:30 to 9 is 30 minutes, but it all looks the same. It's all verbalization. So the thing that we teach is we teach students and young adults and adults to visualize the patterns of daily time. And the patterns of daily time, we use a technique, I should move myself, sorry. I thought I caught it, called ACE Your Time. And let me show you what ACE Your Time stands for. So when you ACE your time, and I have to move myself back over again, sorry if I'm making you seasick, is we have 4 kinds of time. We have time where things are scheduled, like appointments and activities, at a specific time. We have time where we have to assign a block of time to get stuff done, like chores or homework, or something specific like practicing the cello. We have blocks of time for chilling out and being creative. And the one that almost all students struggle with is what we call the extras. And the extras are a really big deal. So let me show you how we roll this out. And I'll give you my example with Roman, and I will stop talking. So I teach students, no surprise, that they need to schedule appointments and activities that are at a specific time. If I take that school schedule I showed you before and put it on a 15-minute increment, that's what it looks like. Now I can say to that student, you have soccer and your tutor. But that's not what you want to do, because that kid's like, yeah, it's not that bad of a day. You've got to see it as a blocked amount of time. Well, soccer is 90 minutes because it's a game. Tutor is 45 minutes. Then we teach students to mime the extras. Here's what the extras are. Extras are any of the extra time that is required for an activity, like the extra time it takes to walk there or drive there and drive back home. It's the extra time to do the routine associated with that activity. It's extra time to shift gears. I guarantee not one of you is going to hang up with me and be productive. You're going to need a minute to get a cup of coffee, go to the bathroom, check in with the dog, check your social media, shift gears. And the most important is we always have to be miming and anticipating the goes withs and the maybes. Here's what the goes withs and the maybes are. You and I know how to pad our schedule. A lot of our students haven't been taught this. Maybe there will be traffic. Maybe after the soccer game, we'll go get ice cream. Sometimes we do that. So I'm going to plan for it. The goes withs are expected. If I drive into Boston at 5 p.m., traffic goes with that. If I go out to dinner on a Saturday night, waiting an hour for a dinner reservation can go with that. I love this one. If I have football practice and football practice is at 4, I don't show up at 4. I got to get there at 3:45, because what goes with it is I have to change into my football gear, have time to leave it in the locker room, leave the locker room, walk across the soccer field, and get to the football field. So once you've got your at a specific time, add the extras. Well, I need to get ready and go to soccer. I need to get home and drive home from soccer. What goes with that is showering and eating before my tutor. And after my tutor, I need to shift gears. Remember, everybody, here's the thing. Schedules are prompts for miming. That's all they are. And, I really appreciate even someone in the chat box is saying, this is hard for me. I don't remember the goes withs. I have lots of families and lots of adults that I work with where this is a challenge. So and I gave you that link in your handout, once they've done the at a specific time and the extras, now we begin to look at chill and assign a time. So if your chill activity is at a specific time, like I want to go to bed and I definitely want to watch the Celtics, but the Celtics are at 8 o'clock. When I show this to students and I say, is this what you thought your day looked like? They're like, I had no idea that this is what my day looked like. Okay, so if this is what it looks like and you want to chill out and watch the Celtics, we now need to assign a time for your homework. Well, I could get my trig homework done during study, and I could study Latin during my lunch blocks. I suddenly get a ton of buy-in from my students. So I want to show you this example from Roman, because even if you're working with a little one, if you have an after school schedule, make sure you put it on a 15-minute increment. That will make all the difference in the world, so that I'm driving to dance class, I drive home. And then we can highlight if homework's a half hour, that's kind of what that looks like. But remember, Lesley said, okay, I'm saying to him, we're going to go to the park, and there's the schedule. We're going to get coffee, go to the park, have lunch, and walk home. And he's like, no, you can't talk to anybody. Just get coffee, no distractions. Well, my sense is that this sweet little guy isn't seeing the time, but instead I might take that. And this is what I showed Lesley when we met in our online session, really highlight, we're going to get dressed to go out and actually schedule the time. Don't say to get coffee, but it is coffee connection time. We have a half hour blocked to get coffee and to connect with our neighbors. We have 2 hours at the park, and then we have lunch. And all of a sudden you can see what that looks like. I worked in a special education school that had students with brain injury, and they had a behavior plan where a student would be able to earn time with a staff member if they had engaged in 70 minutes worth of total productive time during the day. And this is what they showed the student. But the problem is when you look at that, the student couldn't see it. So instead, what we did is we put this on a 15-minute increment and showed where that student could be productive. And then we actually shaded in on the right what he was actually productive, so that they were able to see planned versus actual. So there's a lot of really nice strategies there. And all of that to be said, if you are an adult, check out, we have a brand new Chrome extension coming. It actually got published, but there's a little glitch and it should be fixed. So you want to check it out. It's called Ace Your Time. And what's really awesome about it is it allows you, like, if you're going to put theater rehearsal in Google Calendar, you can now click Ace Your Time and choose all of the events before. Like, I need to get ready, I need 30 minutes for commute, and I need to arrive earlier to find parking. Afterwards, it could go later by 30 minutes. I'm going to commute home. That's 30 minutes to commute home. Actually, I do have to allow for traffic. And when I get home, I need to shift gears. And what you do is click Add Events. The extension thinks about it and you hit save. And then what you can see it does is it adds all those events to your event for you. So you don't have to enter them independently. So definitely check that out. It should be live by the end of the day. We've been working on it forever and we just got approval for it yesterday, but there was a tiny glitch, so it should be set. And this is why I teach time management. So I'm going to stop talking. I started off by asking you what you thought executive function was. A lot of you said planning and organization. I hope that you would now say it's simulation. That's what executive functioning is. It's simulating. And so many strategies. Use photos. Don't worry about that one. I'm going to jump. Make sure you make time visible and ace your time. If you're interested in development, Harvard has their Executive Function 101 course online. It's excellent. These are two very, very good books on supporting executive function as parents. And these are all in your handout. And that is my contact information. And I will once again see if I can't. There's the link to the handout in the chat box.